Good evening and welcome back to Ask 9. I'm Becky Phelps.
And I'm Jim Mertens. In the depths of winter, temperatures are plunging, and you've got a beautiful flower.
I do. This is a tribute from a show I was in, a musical I was in college. Our director made us all little pens like this with this flower on it, because the flower had to do with the show. And the pen did not last forever, but I have reattached this flower to many pens in my lifetime. Since then.
Well, it's nice to see a little flower when there's just like coldness outside.
It brings me a little bit joy. Yeah. Winter is really coming down right now.
Yeah, and it's always like the period of time with cold and flu and the sniffles, and everyone seems to get sick at some point. I mean, the newsroom wiped out mostly during the holidays.
Yeah, not doing well here with staffing for a while.
People recovering.
Everyone is seems to be getting sick. And in the midst of this, we've had some news about vaccinations and the recommendations that the Center for Disease Control and Prevention is giving out. So, to give us a little background on this topic, the CDC is now recommending that children are vaccinated for 11 diseases. That is down from the previous recommendation of 18. So, what has changed? These are the things that are not recommended to be vaccinated against. And they're not saying you can't do it. They're just saying it's no longer on their official recommendations list. We've got the flu, hepatitis A and B, RSV is on this, COVID-19 also on this, although that is a change that came earlier back in 2025. They still are recommending that children are vaccinated against measles, polio, chickenpox, PCV, a couple other things. So since these recommendations have been changing, we've heard a lot of questions. You know, I know some parents who probably don't keep, they don't have the list of all the vaccines. They rely on their doctors for that information. So we are talking tonight here on Ask 9 about what Iowa doctors are saying about the recent changes to these recommendations. KYOU's Soleil Pope White sat down with a pediatrician in Ottumwa to talk through some of these recommendations and see, what do the actual people administering the vaccines have to say about this.
So, with these new guidelines, how are you guys adjusting, if at all, to these new vaccine guidelines?
Well, when I reviewed the report, which is about 36 pages long, they started making recommendations for different categories of vaccines. And so one they say, which is the core, what they would like to have completely mandatory. Then there are some that it's a discussion of risks and benefits with your individual physician, and then they're optional. And so they I'm going to say, from my perspective as a physician, I'm more than willing to accept that they're taking COVID off as a mandatory vaccine. However, for some of those, I'm going to still give them as a part of a standardized vaccine regimen to children here, because we have a different set of community in this area.
And I do want to talk to you a little bit about that, like looking locally. I mean, it kind of changes in all of these areas. So what's that conversation, or how do you kind of determine that?
So the issue is that when you deal with vaccines, there's always a discussion of risks and benefits. And the thing is, the report talks about, from the federal government, how people have lost trust in the CDC because of actions taken during COVID. And so this is part of where I'm kind of middle of the road on this report. I actually kind of agree. They did a lot of things that disrupted trust. They were very, I would say, opaque or not very transparent about why they were doing things. And because of these actions by the CDC, the new acting director of the CDC shows that vaccine rates plummeted because of the actions of the CDC. And so they are trying to renew trust in the CDC, and their idea of doing that is sometimes to change all the recommendations, and they're trying to boilerplate some of the vaccines.
Okay, and what are some questions that local parents are asking about this new guideline?
Well, I haven't had any actually ask me about it yet. I don't think the report is so brand new. Most people don't have time to read a 38-page government report, to be honest.
If you had to predict what it could look like and some questions that parents could have, how would you be able to clear up some of that confusion?
So the thing is that the big thing is they talk about the doctor or the specific ones that where they're like optional, and it's a discussion between physician and the patient and the parents of the patient and everything else. And so for me, they've taken off the Hep B as a requirement, and they've started taking Hep A as an optional one. And so from my perspective in the matter is there are well-known reports of where children receive hepatitis B through maternal pregnancy, so that's where the mother gets the infection and passes it to the baby. And the baby, because nobody knew that mom was infected, sometimes the tests are not always accurate in pregnancy, and so that baby gets a chronic liver infection, and then that baby grows into a teenager and an adult, and they end up having liver failure at an early age, and they get a liver transplant later on. And so since we started doing the whole Hep B vaccine thing, transplant of livers has dropped for chronic hepatitis B, has dropped precipitously, and now has been more hepatitis C and fatty liver disease. The thing is that even Hep C is dropping because they have a new antiviral that's been out for several years that we now can cure people of Hep C. And then when Hep A outbreaks come out, most adults will survive Hep A. They'll get really sick, but a subset of children will go into liver failure and their liver will not recover. And so that's why we do a hepatitis A vaccine, is trying to prevent that one child from going into liver failure.
And so because of that, if they're taking something like that away, and they're taking even like the flu, I mean the flu is increasing right now, and they take that away, then...
Well, the thing is that they're saying, so like I said, I'm middle of the road about this. They're saying that they're not going to mandate it. However, it's still going to be supposedly covered by insurance. And so the thing is that I would say when the mandates for COVID came out, I actually had people have a drop in interest of actually getting COVID vaccine, because now what does the government want to do with this? What does the government want to do? And why do they want me to mandate this? And so flu vaccine, in my perception, is I recommend it usually. It's not perfect. You're trying to predict different types of different flu viruses out there, and they can do some reassortment things in between depending on pig and kind of poultry infection rates. And so it can come out with something brand new. However, even if you give people partial immunity, they won't have as a severe thing. However, I do believe in the Constitution. Obviously, swore it to uphold it. So people have every right to say, no, I don't want it. However, I think that they should be able to take the responsibility of exercising their freedoms.
Okay, and so when it comes to parents bringing their child in and doing routine checkups, what would be the conversation if my child just got the flu shot and going forward it's like it's no longer recommended? Well, do I still get it, or do I?
They're going to receive it in my office if they're willing to get it. A flu vaccine is a discussion between parent, patient, and physician, and I think it's a really good idea. And there's historical data talking about flu pandemics from 1918, where young people and children were the first people to get really sick, die, and a whole bunch of other stuff. And this happened after World War I. It's also where we developed the data that said that masks don't work in viral pandemics. And unfortunately, the CDC at the time squelched that data along with some of the tech companies, but that used to be freely available, and that's why we didn't propose universal masking mandates for pandemics at all back in those days. And so the thing is that the people that survived from the 1918 flu pandemic after World War I were people in their 40s, 50s, and 60s who had been exposed to the Spanish flu, which was approximately, if I remember correctly, somewhere around the 1890s. And so they survived because they had a partial immunity because they had been exposed to one of the proteins of the flu that was coming out during the 1918 pandemic. And so the thing is that I would say the report talks about natural immunity, and I do think natural immunity is important. However, to get natural immunity, there's going to be downsides for both groups, especially with people who've got immunocompromised systems. And the problem is that it's hard to always identify people who have immunocompromised states.
Okay. Now I'm going to speak to you from just a parent perspective. If I were a parent and I say if skipping some or delaying some vaccines, would it cause a problem for my child? What would be your response to that?
Well, the issue is that it's when you delay vaccines, the question is exposure and statistical chances of exposure. And so, like, for instance, when I have parents who come in and say, I want to delay their vaccines, however, I'm going to travel to X, Y, and Z country. Well, if X, Y, and Z country is very prone to these outbreaks, guess what's going to happen? You delay it, your child goes overseas or the location where the outbreak's happening, and then your child contracts it. And if you're outside the United States, your child could be hospitalized in another country. Your insurance, depending on whether you bought the traveler's health insurance, may or may not pay for it. And now you're stuck in another country with a sick child, and you don't know when they're going to leave that country. And so the thing is that that's why sometimes delaying them, especially if you're traveling, is a big issue. But the other thing is that sometimes if you're starting to delay, what happens like, oh, I only want my child to have one shot at each visit. Well, then you're just delaying out all vaccines, and the child's getting larger. They have a harder time getting vaccines. They will literally fight their parents and us as the physicians and nurses to give them vaccines, because all they think of is that they're getting a needle poke. They don't understand that this may be a way that they keep from being hospitalized and really sick.
Okay. And so for parents right now, what is the most important thing or practice that they could kind of do with adjusting to this new thing?
Well, the issue is I highly recommend each person, especially the parents and with the children, to go and talk to their physician, their nurse practitioner, their PA, who they see often, and get their opinion about what this report means. I have my own opinion. I'm probably going to stick to pre-COVID CDC guidelines for vaccines. I'd like to see them do a little bit more data reveal with this report, because they said certain things about certain vaccines, how they haven't been proven in X, Y, and Z. However, the issue is that if they have concerns about its efficacy and stuff, and they wish to discard it, then I would like to have them either sponsor a grant, develop some kind of research, and give it to a group to really crunch the data, who is non-biased, and do what the real scientific research is supposed to be. So when we have concerns as physicians about recommendations, we say, show us the data, show us what's going on. If we have concerns and we're arguing back and forth, well, let's bring some objective data. And so I, again, take a middle of the road look at this thing. It is calling out some scientific laxity or laziness that has gone on with the CDC. And my thing is that having a skeptic look at each one of these is helpful. However, the issue is that my concern is that there's sometimes we call aggregate data on some of these vaccines. They've been out for so long. They've done so much stuff with them. There's so many people years attached to it. To say that we need to discard it, they need to have some kind of aggregate data that disagrees. And I would like to see a head-to-head, apples to apples, oranges to oranges evaluation of that.
Do you think that would happen?
Well, my hope is that that would happen. I'm going to use a kind of something that's happened in the past. When you look at the Columbia Challenger disasters, those are space shuttles and everything else. There was an engineer that was warning the NASA that, hey, you shouldn't be doing this because this is a critical piece. And so when they say there's a critical piece, and when that critical failure happened, and they made a decision based on maybe not so good data, that has a very large effect on the population. And so the other thing that I have with the report is the issue is that trying to identify higher risk individuals, especially amongst children, I don't have people coming out and saying, hey, I'm doing X, Y, and Z high risk activity, like drugs, alcohol, other things. And so
that is Dr. Case Everett from the Ottumwa Regional Health Center. He's a family physician being interviewed by KYOU's Soleil Pope White.
A lot of points is that a lot of these doctors are saying we got to use good science. You can't ignore years of science or years of use. The other thing is that, as you were saying, these are recommendations. So they don't recommend that you get, let's say, a COVID-19 shot or some of these other shots. And the thing is, if they don't recommend, then you don't necessarily get it for free, or insurance doesn't necessarily, cover it in such a way. So that's where the recommendation ends up having more than just maybe you should use it, maybe not.
We did today get an update on the flu numbers here in Iowa, so I want to run through those really quick. The respiratory virus report that was just released, and by the way, that covers last week. So this is the numbers from January 4th through the 10th. It shows that COVID cases were up and flu deaths jumped from the week before. We're now reporting 31 flu deaths this season in the state. That's an increase from 14 who died the week before. Flu activity and COVID activity are both high right now, and 11 schools are reporting 10% or more of its population out sick. So there is a lot going around right now. The doctors that we've talked to, the county health departments, say, if you get vaccinated if you can, there's still time to do that, and wash your hands. The basic things to stay healthy still always apply.
Well, and we had talked about the fact that the flu was spiking after the holidays, COVID-19 pretty much staying flat, so for that to rise as well, some of it's the normalcy of the flu and cold season of winter. But yeah, you're going to see those rising generally January into February. The key is the severity of it as well, and that's what always is worrisome in those people who are the most susceptible to not only that, but the underlying problems that can cause your situation to get much worse.
Absolutely. That's what we've got for you here tonight on Ask 9. As always, if you've got any questions you'd like us to look into, send us a message on Facebook or shoot us an email. Have a great evening.